Hello, my name is Hubert Ametefe. I'm the head of cybersecurity for one of the NHS Foundation Trust, Bedfordshire Hospitals. Bedfordshire Hospital is a combination of two hospitals, Luton and Dunstable Hospital and Bedford Hospital, east of England. It caters for 1.35 million patients within that geographic area. We have a staff strength of about 8,000 and have a well-developed IT environment. I'll start by using an example. You all knew about WannaCry. So one of the challenges we had was we didn't have the visibility of assets. And also in terms of patching, we were relying on Microsoft product, WSAS, which in itself was not working for us. That meant we had missing patches. Patches were not being tracked. It wasn't being reported properly. So that was one of the challenges in terms of patching. With AD management and AD audit, we're still using Microsoft Management Console for AD management and auditing, and then at most using PowerShell. Reporting was quite intensive in terms of man hours, and it took a lot of admin. So having a tool like AD Manager and AD Audit simplifies the auditing simplifies the management of account. Now we can actually automate how we manage AD account. So rather than running a script to disable stale account, that is sort of just set. 80 days or 90 days or whichever day we set, and that is done automatically. So it actually removes the human error from it. We can track the changes that have been made and all that. It feels like ages ago. Okay, so I actually started from a different trust. That was when I did the POC. That's 2018, I think 2018, either 2017 or 2018. We didn't sort of take it up in that trust. When I moved to the current trust that I am, I sort of brought that, what I have seen, and then the benefit that I've seen from even from the trial. I did look at other products on the market, but looking at the cost of those products and what ManageEngine was sort of providing, that actually made the difference in choosing ManageEngine product. Okay, the ManageEngine products that we have been using, I think since 2018, I think, or maybe 5 years ago, we are in the process of developing that more so that we can give access to our third-party workers, so that when they sort of log onto our servers to do stuff, we can see what they are doing because it's recorded, it's audited. And it also gives us the ability to have the separation of duties from what the guys are doing. Just to circle back on the AD Manager, I did mention earlier on about the sort of the level of automation that it provides. What we are using, it might be as basic and as re-enabling disabled account because someone has locked their account. It would have been good if we were to have implemented AD self-service, which we have, that they could reset, they could unlock their accounts by themselves. But the benefit of having AD Manager is we have a workflow that sort of tracks and then unlock those accounts. If it's something that is repeated, possibly that account is sort of compromised, we know. There is the alerting mechanism. I think it is the UABA inside that does alert us as well. So yes, we have that mechanism to ask AD manager to unlock a locked account, but we have the guardrail of having the UABA to let us know that, look, this is something that is happening, reoccurring, and then we'll sort of react to that. So those are the products that we use, and that's how I see the benefit from it. I think that bringing it simply, AD Manager Plus, the challenges that we're having were accounts that are still accounts that have not been logged on a number of years, months, or even disabled accounts that have been in that disabled state for that long. Using sort of the native Microsoft Management Console wasn't cutting it, and having to develop a script to manage that automation again wasn't cutting it as well, because you need someone who understands scripts. AD Manager, what that gives us was the sort of the UI, the simplicity of sort of automating that and sort of just passing that on to the sort of the service desk. Again, account creation, bulk account creation. We are now able to sort of provide a CSV file that gets sort of those accounts gets created. So it simplified our account management. And I did mention again about the locked accounts. The number of calls we get, especially when the password change cycle hits and then people reset their password and then forget that they have reset their password. The number of calls that comes to the service desk is quite huge. That sort of improved that. And it will surprise you as well that nurses use multiple devices, and doctors, they log onto different machines. We do not have, most of the staff do not have a one-to-one mapping to devices. So they log onto different devices to do their work. Yes, they need to log out, but they don't. They get logged in, change their password on a different machine, and now it becomes a problem. So again, what the likes of AD Manager and AD Audit helps us is able to track where the people have logged onto those machines and sort of log them out. So that AD Manager, AD Audit gives us that flexibility, something that we used to do by using sort of script, which requires in-depth knowledge. Now we can actually devolve that to the sort of the service desk. Again, how we have used AD Manager, we have delegated it to a few service desk a team. So it's not sort of a large team. Most of the delegations are done to people that we trust. They've been trained on how to use, and then they were doing that in AD already. But it gives us the ability to revoke access to to those people. The challenge we have is we have not transitioned fully, because they still have the Microsoft Management Console. But moving forward, we are looking at rolling it out and then removing access to that is when sort of the delegation will be done. But we see the benefit and then the potential of the delegation. NHS uses, as you know, processes highly sensitive patient information. So we use AD Audit to sort of look at people who are actually looking at files they shouldn't be looking at. So AD Audit gives us that we have created some alerts that when it triggers, we get the report. In terms of people locked out accounts, we do get alerts of those as well. And then the dashboard as well, we present the dashboard as well, which gives us a single pane of glass to see how we are looking in terms of locked accounts, people who have reset password, people whose password are going to reset. I'll sort of move further and say we have actually implemented sending notification to staff about. Okay, so in terms of alerting, we have created alerts to notify staff and colleagues when their password is going to expire, and for them to do that as well. So we sort of leverage on that type of alerting as well. And we do use the surprisingly the user and behavioral analytics component of it. To sort of see, well, does that person needs to be accessing that and from what machine? In terms of okay, so if we now move to sort of users, I did mention about the being able to audit someone who is accessing sensitive patient information, and that report is there. We can do a GDPR reporting, which NHS has to heavily rely on. We can do that. So AD audit sort of does that for us. So that's compliance and sort of reporting. With the user and access management, we have all staff needs to have an account, right? Yes. So that is a piece that works. Even if it's in the cloud, we still have to create accounts. So in terms of how ManageEngine can help sort of NHS, is that an identity and access management solution. Having a look at AD Manager, it has the HR component that if it is sort of devolved or sent to HR, HR will create their account because they are the front door. They create their account, so the account doesn't need to come to service desk to be created. So it is that. So in terms of how ManageEngine can support the healthcare, I'm looking at the device health in patching, and then an identity and access management solution. Yes, in my role as a cybersecurity lead or cybersecurity expert, yes, I will recommend ManageEngine products to help protect and secure your environment. Because let's face it, when you're outside, you think healthcare, IT in healthcare is any different from anywhere else. Yeah, it's not. The only difference we have it's the medical devices, of which, if you look at this building, it's almost the same because you have door management solutions. Those are the IoTs. So it's not any different. So yes, we have medical device, but medical device has either an embedded OS in, which is the same as this door management system. I had that challenge before I joined NHS, because when I went to my career development, they said, well, have you looked at NHS? I was heavy into IT. Have you looked at the hospital? And I was like, hospital? All I know about hospital is needle and nurses. And he said, no. And then when I went in, my mind was blown. The level of tech they have is huge. So in terms of looking at security within a hospital, it's not any, if I say it's not any different, it's a bit more complex, because you will, like I said, you will have within an average hospital, you might have more than 120 different applications that are used within the hospital. That is sort of huge. That is sort of clinical applications. And then if you include the likes of the third-party applications that are installed, you are looking almost about 400 and that. So yeah, it is complex. It's not simple. It is complex, but it's not that different from most of the organizations that you are in. First of all, it's more integration. Good that I heard that there is the sort of the unified agent that is being developed that will sort of unify. So that is what I am sort of looking for. And also quite difficult for me to sort of sum it up and say, well, this is what I sort of want. In terms of support, the support is sort of good. So again, I think you are starting now more of user engagement. Maybe if I say regular, maybe monthly, quarterly, someone sort of just rocking up and then asking us what are the problems, or if we have technical problems, someone can sort of come across and help. And I think you guys setting up in Milton Keynes, having a UK base, yes, will offer that support, that one-on-one support. The remote support is good, but sometimes we sort of just want someone to be there to look over our shoulders whilst we are sort of fixing that. So for me, those are the two things that I would want from ManageEngine: being able to integrate ManageEngine to other solutions that we have, and then the on-site support. The other ManageEngine product that I am looking at the moment, from sort of operational point of view, is the Operational Manager. That's one. Looking at the log 360 for log analytics, and looking at data security for, as it says, data security. So those are the three products that we are sort of looking at from ManageEngine.